I'm Mariko Ishimori. I'm a rheumatologist at Cedars-Sinai Medical Center in Los Angeles, California, and I have been working in lupus. I work with my colleagues, Dr. Daniel Wallace and Dr. Caroline Jeffries, and we are part of a lupus center here at Cedars-Sinai, doing our research and learning more about lupus so that we can improve outcomes for patients and offer new options for patients. And I think one of the areas we've actually been interested in is looking at differences between men and women with lupus. So this kind of topic dovetails nicely with some of the work we're doing here as well. So I'm excited to share some information, and let me know if I talk too fast, because I've been told sometimes I can talk a little fast. I'm also a medical advisory board member on Lupus LA, so I do work with Lupus LA in that regard as well. So I guess if we're ready, I did prepare a handful of slides just to kind of provide a little bit of framework about some information. And Lupus LA was kind enough to send me some kind of common questions. And so I hope I can answer some of the common questions, and then we can kind of get into any other things that might come up. All right.
Perfect.
So Brianna, you ready for me to go to the slides?
Oh yeah, let's do
Hopefully
this.
everyone can see them. All right. So I'm going to use the terms male and female as they're basically, we're going to use them as sex assigned at birth. I think it gets really complicated if we get into the gender piece. So what we have a lot of data on is just using kind of this biological sex piece. So we'll kind of focus on that, and then I'll get a little bit more to other topics at the end. So be patient with me. So I think everyone on this live stream probably knows that lupus can affect any organ system. We know that lupus can look different, and you can meet another lupus patient, and you might not have the exact same features and findings, and it can present mildly or more severely, and everything in between. Um, and then traditionally, in the studies, we've seen more females in studies. And so the ratio is skewed female, especially during kind of the ages between around 14 to 50. When we think about reproductive years, we think of it, the disease being present 9-1 female predominant. But when you look at children before they go through puberty, the ratio is a little bit less. So it can be anywhere from 2-1 to 6-1 female. And then similarly in the postmenopausal group as well, the ratio is a little less skewed. So, and I think especially in men, and one of the big challenges is that some of the cardinal features of lupus that we think about may not be present. So you might not be able to see the lupus from the outside in some of these kind of male patients. If you don't see the classic malar rash or some of the sun-sensitive rashes or the arthritis, it can be really difficult for perhaps even another lupus patient to believe that you have lupus, and also get the support that you need from your friends and family who may not understand that the disease could be very different in men and women, even though there are many commonalities as well. So some of the differences we see are we do see a lot of organ-threatening disease in men, and then more severe manifestations and aggressive disease course can be had. So a lot of times we'll see people present with some type of organ manifestation like a kidney disease, and we jump right into therapy. And then, there can be delays in diagnosis. They can have poor prognoses because of that compared to females with lupus. And then there can be less the musculoskeletal findings, the joint pains, the swelling, the muscle findings we may not see as commonly in male patients. It doesn't mean it doesn't exist. It just may not be one of the early features. And then the skin rashes are different as well. I think the other thing that's interesting is once lupus patients are over 50, we start seeing more common causes of death aside from lupus itself is infection in female patients. And then in male patients, it's actually heart disease. So that's interesting. And I think when we look at these lupus studies, one of the caveats is that there are very few men in some of these studies. Some lupus studies have 0 male patients, 4% in some cases. I think the highest we've seen is about 20%. So you can see that the amount of the population that's participated in studies of male patients is pretty low.
Wow.
And then there are some sex-specific differences in how lupus presents between male and female patients. But we don't really know why this happens. And so that also remains an area of interest. So when we think about disease features that are more common in each sex, in male patients, given if you take 100 male patients, about 60% are going to have kidney disease compared to 30% in similar grouping of female patients. So it's much more common to have kidney disease in male patients than female patients. We see a lot of heart complications, then serositis and pericarditis, which are inflammations of the lungs around, inflammation of the membranes around the lungs and the heart. We can see low blood counts. Sometimes we'll see hemolytic anemia or low platelet counts, for example. There may be fever that may be occurring for a while, unexplained weight loss, and people might think it's cancer or another diagnosis. We can see blood clots. There's some mixed data about lupus anticoagulant, which is one of the phospholipid antibodies being present and causing blood clots, whether in a leg or in the lungs. And then the average age at diagnosis in males is a little older, 40, as opposed to female patients. The diagnosis average age is around 30. And then the characteristic features we often see in female patients, the classic malar rash. So in this picture, you can see the redness, and you can see that they're sparing around what we call the nasolabial fold. So just to the side of the nose, you can see there's a little clearing, and that's a pretty classic sign. Sun sensitivity, we tend to see more in female than male patients. Again, it doesn't mean these things can't happen in both sexes. It's just more common in female patients. The joint pain and swelling and oral ulcers are also more common in female patients. And then hair loss. I think hair loss in female patients is more striking and more concerning. It's hard to differentiate hair loss sometimes in male patients. There are a lot of male patients who lose hair for various reasons at different age groups, so that can be a little more challenging. And then again, the younger age of diagnosis in female patients. So there are other things that are not different between the sexes. And so what's interesting is despite male patients having more kidney involvement in a given group, the type of kidney disease is very similar. So we don't see a lot of sex-specific differences in terms of what's in a biopsy. And then the number of ACR criteria present might be about the same. We might not see that there's much more enrichment than one or the other. It's just that we might find that the criteria that are present are more in the organs. The other interesting thing is there's one specific rash that's called the discoid rash, which is more of a chronic skin lupus that leaves scarring. It tends to like the side of the face, the nose, the ear area. It does heal with this kind of atrophic, like a little bit of a divot almost. And that can present similarly and at similar frequency in male and female patients. We also see the antibodies that we test for can be similarly present in males and females, although there's a couple studies that say maybe double-stranded DNA might be more common in males. And the treatment options that we offer really don't differ between male and female patients. So some of the more commonly reported symptoms when they've had these small groupings of male patients in studies, severe fatigue and the weight loss have been reported, headaches, swelling in the face, hands, or feet. We can see some of the swelling when people have kidney involvement and the blood protein level gets lower, so you'll see edema. And then discoid rashes we see, and then the weight loss. And then we don't really know why there's these sex differences, but there are several potential reasons. And starting with the differences in the immune system, I think during COVID, we learned a lot about the differences between male and female immune systems and response. And that still is something that we're learning about as it applies to lupus. The effect of sex hormones also, and what that does, and which might also explain some of the differences during reproductive age years where we see more female involvement versus before puberty and after menopause. There are some differences in how genes are regulated. The number of X chromosomes may make a difference as well. There's some male patients who may have an extra X chromosome called Klinefelter's, which has been associated with increased lupus risk. There may be difference in environmental factors. Things like smoking is more prevalent in males than females, for example, differences in the gut. And I think other things that we see, maybe we miss joint and oral ulcers because there's a delay in diagnosis in men. And it might be because doctors are less likely to consider lupus as a diagnosis in male patients. And then there's also the other factor where males may be less inclined to seek out a doctor or medical care for symptoms they might have. They've shown studies in which the number of outpatient visits and ER visits, there are more female patients coming to the ER and outpatient clinics. And that might be part of the problem. And there might be issues in taking prescribed therapy or understanding or asking the questions why a therapy is needed. So another question that was asked is related to whether or not lupus itself or lupus treatment can affect male fertility. And so there have been some studies that have looked at some damage to the testes or the testicles in lupus males compared to males without lupus. And so there is an ultrasound study that actually showed that there was lower testicular volume and lower total sperm counts, and there may be lower amounts of normally formed sperm in lupus males, but it does not necessarily affect fertility. There's no definitive evidence that lupus itself can cause less fertility in lupus men. But if you get into the story of the treatment, I think that is definitely where we can see a change in fertility, which also affects lupus women. So when we think of cyclophosphamide, which is used for organ-threatening disease, and with male patients having more organ-threatening disease, we might see more use of cyclophosphamide. And that can damage the cells that produce sperm and lead to lowered sperm counts temporarily. There are some studies that also show that the more of this drug and the longer this cyclophosphamide is used, the more likely there is to be a more permanent decrease in sperm volume and counts. So, and then corticosteroids, kind of a commonly used therapy, prednisone, prednisolone, methylprednisolone. They can also lower sperm counts and testosterone production while you're taking that therapy, which is generally reversible. So what's interesting is that there have been studies that have shown lower testosterone levels in lupus males, but it's not a universal feature. And then we don't know for sure that there's no convincing evidence that there's actually a decline in fertility from lupus itself, even if there's lower volumes or lower sperm counts. But obviously the therapies are a concern. The only exception actually to this comment is that males who have Klinefelter syndrome, which is an extra X, so they're XXY instead of XY chromosomes, and there have been studies showing higher rates of lupus and infertility in Klinefelter males. Similarly, the XO female, which is the Turner syndrome female, also has fertility issues as well, and actually has a lower risk for lupus. So that goes into some of the X chromosome potential link up as well. Using the higher doses of cyclophosphamide that I mentioned and longer use can cause irreversible damage to sperm production. And then if cyclophosphamide is going to be a needed therapy for disease, then we recommend prior to starting that infusion or that therapy, going through sperm banking. It's much easier for our male patients than our female patients to preserve fertility in this regard. So we recommend cryopreservation or freezing sperm. So how do doctors diagnose lupus? I think one of the big things I want to get across is that there is not a single blood test that diagnoses lupus. I think there are many people who've tested positive for anti-nuclear antibody and they get told you have lupus, and that's not the case. Positive ANA doesn't confirm a diagnosis. Can be seen with a lot of other diseases. It can be seen after infections, other autoimmune diseases as well. But the ANA can be a starting point and help us ask the next questions so that we can try to see, hey, do we need to explore what's going on here and find out what might be causing some symptoms for patients? So we use a combination of history, physical examination, lab testing, and depending on the features, we'll do skin biopsies and kidney biopsies to help us reach a diagnosis. And it's really the expert opinion of a rheumatologist that helps us. And it's there's these criteria that are out there, the ACR criteria from 1982, 1997. Now we have the more recent classification criteria that have been developed. And these are kind of developed by professional societies mainly to help us enroll patients in studies so that we can say we had some type of criteria that help us universalize the patients that are in the study. But they're not necessarily diagnostic criteria, although they can be helpful to help guide people along the way of what they need to think about when we think about a lupus diagnosis. And I think the important thing to again remember is that we're not a cookie cutter disease. So not all lupus patients are going to have the exact same formula of features and findings. And that's where it becomes more challenging to diagnose. And so this is the most recent EULAR ACR criteria. It's like a point system. You add up the points each, you basically pick this thing with the highest item in each box, and if it equals more than 10, we use this to classify disease, just so you know. So common blood tests and other tests that we use to diagnose lupus, we do complete blood counts, looking for anemia, looking for low white cell counts, low platelet counts, low neutrophils, even low lymphocytes. We'll look at blood chemistries, looking at total protein and albumin levels, kidney function, liver. We look at urinalysis, looking for protein and blood in the urine. We look at inflammatory markers called erythrocyte sedimentation rate, or C-reactive protein. We look at complement levels, ANA and other associated autoantibodies. You might see a big panel of tests, or you may have already had them. Antiphospholipid antibodies, imaging tests, depending on what's involved, and then biopsies, depending on what's involved as well. And the most common biopsies we do are in the skin or kidneys, but there can be other biopsies of nerve or even brain tissue as well. So proactive things that we think are recommended for lupus males, on any lupus patient really, is getting involved and learning more about your disease. Patient education programs are really important. I also think that educating family, caregivers, friends is really important as well. I think having this kind of disease can be isolating. Feeling like you're alone can be isolating, and feeling like people don't understand your disease is frustrating, right? So it's not going to go away with a green juice or a specific supplement. So I think that's key in terms of educating the people around you to understand your diagnosis and why your diagnosis might look different than a female patient with lupus. Talk to your rheumatologists, your doctors about the therapy that you're taking and why you're taking that therapy and what are the potential risks and benefits. And if you are taking a therapy, stay on it, or talk to your doctor if you need to make a change or you feel like the medication doesn't agree with you, doesn't work for you, or you have questions. But taking the prescribed therapies is important. We advise people not to smoke cigarettes, limiting alcohol intake, keeping up to date on general health maintenance. Just because you have lupus doesn't mean other things can't happen as well. So making sure to go to your annual physicals. Also checking for heart disease risk. We know that heart disease is a top problem in men's health. And so regardless, we definitely advise people to go and get routine checkups. Regular exercise, and then depending on what's involved, physical therapy and occupational therapy may be helpful. We generally recommend limiting UV exposure, which may be a trigger for lupus. For people who have brain fog, cognitive therapy may be helpful. Mental health support is very important as well. And then patient support groups, meeting people who have the same diagnosis, who may or may not have the exact same manifestations. And you may not always find that everyone in your group has the same findings, but hopefully understand that you're not the only person, you're not the only male lupus patient out there. So there's a lot of other questions that remain. And I just wanted to address, we don't really know how hormone therapy may play a role in transgender men and women in affecting risk for lupus. There are just a handful of case reports out there. There has been a case report of a trans woman who went on hormone therapy and who developed lupus. There's also a case report of a trans man who had lupus skin lesions who improved on hormone treatment. So the population for us to study is very limited in this regard. So we really don't have a lot of other information other than case by case reports at this time. And we don't really have any studies in non-binary patients. And I think the other thing is most treatment studies have enrolled a small number of men. So most of the time we're taking data that's been from predominantly female patients and applying it to the treatment of both males and females with the disease. So I just wanted to also just put a plug in for a currently enrolling study. We are actually looking at men with lupus and doing a cardiac imaging study, looking at whether or not we can see differences between lupus men compared to lupus women that we've studied. We're looking at coronary CT angiograms, looking at the heart disease in regular coronary arteries, the usual coronary arteries, if you will. And then we're also doing cardiac MRI to look at the microvascular, really small vessels in the heart that might be impacted as well, and whether or not that can be different in men or women with lupus. So if you're interested in our study, feel free to reach out to us. My coordinator is Brian Gonzalez, and we're happy to answer any questions about that. It's been approved by the IRB, our Institutional Review Board. It's funded through the NIH with Caroline Jeffries and Don Wallace and myself, with our collaborators in the Women's Heart Center at Cedars-Sinai, Noel Berry Mers and Janet Way. So if you're interested, please reach out to us.
Nice.
And then here are some references that we included, and thank you for your attention.
Thank you so much. Dr. Ishimori, do you mind answering just one or two questions that we had come through from the community around pericarditis?
Yeah.
So someone asked, how common is pericarditis in men with lupus? I know that you had mentioned that that's something that maybe
Right. So
more than
yeah,
women.
pericarditis is one of the what we call serositis. So pericarditis, pleuritis, we tend to see more commonly in if you again, when we say more commonly, if you look at a population of male lupus patients, we see a much greater number with pericarditis than we would in the same number of lupus women. So it's a much more common feature. It can be how men present. The first time their lupus is apparent might be from pericarditis symptoms, which can cause discomfort, can't lie back, chest pain, making it difficult to breathe.
Okay. That's really helpful. And then someone asked, why does pleuritis and pericarditis happen in lupus? Like, what causes it?
So it's probably related to some of the kind of immune activity and immune complexes that might form and cause activation around that area. We don't know specifically why it likes the serous membrane so much, but it is a known association.
Okay.
Yes.
Thank you so much for your time. In response to the slide that you shared about support, I just want to throw out there that for anyone listening, if you are, a man living with lupus or know someone that is, Lupus LA has a monthly support group for men that's led by two amazing facilitators that both have lupus themselves. And if you go to lupusla.org/support groups, you can go and see what times and dates are available. But it's a global support group, so anyone can join it virtually from anywhere. You don't have to live in Los Angeles or even California. And the facilitators actually aren't even located in that area. And it's a really awesome group. So I would encourage anybody who's interested in testing that out. You don't have to speak when you join. And even if you don't necessarily need to seek encouragement or ask specific questions, you can also just encourage someone with your story. So we'll drop the link in the comments for that as well for anyone who wants to join. And then we'll also share the link to join our community so that you don't miss talks like these that are coming up. Thank you so much for your time. We really appreciate it.